right now.
There's a good chance either you or someone you know takes prescription drugs. I mean, that is the reality for about 66% of adults here in the U.S. Here's the thing, though. About half those people, they don't take their meds as prescribed. And even if you do follow your doctor's orders, maybe the drug you're taking isn't best suited for you. And all of that can lead to worsening symptoms, hospitalization, or even death. In fact, a report published in the National Library of Medicine said adverse drug reactions, or ADRs, are between the fourth and sixth leading causes of death worldwide. That is right behind heart disease, cancer, and stroke. But what if you could make sure you're getting paired with the right stuff right away? Well, that's what a company in Kalamazoo has been trying to do for the last 10 years, testing your DNA to find the best solution. Although some skeptics argue even this tool isn't perfect.
This is my husband's favorite casserole. It's potato, kielbasa, cheese, onion, and like a lot of butter.
Stacy Young knows what it's like to find that perfect recipe in her Portage home. But Young's experience with food has been much different than with her health.
But this is my daily medication.
Young was diagnosed with Crohn's disease at 16 years old.
It was Thanksgiving, and I just got really sick one day, and I've been dealing with it I'm 51.
Crohn's is a type of inflammatory bowel disease. It cannot be cured, although some can live with it nearly symptom-free. But that has not been Young's experience.
It's horrible. It's awful. It rips your life apart. It's very, very painful.
That pain led to other problems. Young says she started to suffer from severe anxiety and depression.
The last time when I had my final surgery, my mind believed that it was okay to die.
For years, Young and her physician had been searching for the right combination to curb those psychological symptoms.
It's been a long time, and we just kept like throwing shots in the air, trying different things. You know, of course I'm in therapy, different medicines, nothing was working, and then this test came along.
Would you say this test changed your life?
Yes.
It's called pharmacogenomic testing, or PGX. And the team at Genemarkers in Kalamazoo has been using it since 2014. Anna Langerveld, the company's CEO, explains the process.
Is a test that allows us to take a sample of someone's DNA from their cheek. It's a simple cheek swab, and we can look at mutations in different genes that are associated with or that direct the regulation of medications.
In other words, Stephanie Wheeler, the clinical testing specialist, says it examines how your genes might influence the way your body responds to different medications.
So if someone metabolizes that medicine too quickly or too slowly, then they either are at risk for that medicine not working, not giving them any therapeutic benefit.
Genemarkers takes your DNA and tests for 56 possible mutations in 20 genes. Those results, which Wheeler says are more than 99% accurate, are then reported to your healthcare provider within 7 to 10 days of receiving your swab.
Sort of has like a little summary table of yes or no, you had this mutation, list of all the mutations we tested for, and then a table of all the medications that are covered on our test and if it should be like recommended, use of caution, or considered alternative.
Genemarkers PGX tests can predict how you might respond to 84 different medications dealing with allergies, heart disease, and pain, to name a few. They also look at psychotropic medications, ones that treat your mental health, like in Young's case.
For me, it came back that there was just one specific medication that was going to help, and it did. And it was just really, I was gobsmacked, to be honest with you. And it's still working.
But some experts, like board-certified psychiatric Dr. Charles Nemiroff, caution against the use of PGX in that specific setting.
The problem with psychiatry is we don't really understand what the molecular or biological causes of these diseases are. So we don't have a basic understanding of the causes of our disorders to a level that would allow us to develop these tests.
But even Nemiroff admitted PGX can be effective at anticipating side effects. Genemarker says their test is now covered by Medicare and some insurances, and your privacy is never at risk.
We destroy the sample after the test is reported, and we do not share anybody's information. We don't sell it to any third parties.
Genemarkers is licensed to receive swab samples from all 50 states, helping hundreds of people, like Young, find their ideal medical formula, that perfect recipe.
Just happier. I don't have as many worries so quickly. Not as uptight. I'm very uptight all the time, but I'm not as uptight, and just happier. It's just an amazing experiment that somebody figured out, and it's life-changing. It really is.
Genemarkers says widespread acceptance of pharmacogenomic testing in healthcare has been a little slower than expected, but it's only increasing. If you're interested in learning more, you should either talk to your healthcare provider or call Genemarkers directly, and you can find their number at the bottom of this story on fox17online.com. Reporting in the studio, Max Goldwasser, Fox 17 News.